I was shocked, scared, mostly in disbelief because I didn't think that this could be possible since my husband had just passed from AML. To be diagnosed with a serious illness and then not be able to fix it. My husband passed away, and when he did, I was really at ground zero. So I lost a lot of weight. I was very tired, very fatigued. I was kind of breathless. I was just really low in activity and sadness. I went for a regular checkup in December. My husband died in November. I went in December, and I had a pretty big weight loss, about a 17-pound weight loss. And I was very tired. They did blood work, and they said, you are very anemic. We're going to give you B12 shots for a while, and we're going to see if that helps you improve. After about 6 months of very slow improvement, they said, we really need to send you to a hematologist oncologist for some additional testing. And they did all of the typical testing, endoscopy, colonoscopy. They did an x-ray and they saw a little spot on my kidney. They sent me to a kidney doctor. I also did a pill cam that went through your entire system to see if there was any possible bleeding. And those tests were negative. So I knew then that we were going to go into something more. And that's when they thought we should do a bone marrow biopsy. I was fairly close to normal at that point, like in the 11 range. And so they said, we really need to do the bone marrow biopsy to get you an accurate diagnosis. And I said, no, I'm not doing it. You're chasing a number. I was in total denial. I was like, this is not happening to me. And I left. I said, I'm not doing it. So I just thought, this can't be real. And I continued to say, I think if I get acupuncture, I think if I eat better, I think if I really try to go back to my physical exercise, I'm feeling stronger, I don't want to do this. And I left. I said, I'm not doing it. So then fast forward 3 years, and I went for my regular checkup, and this time I had an 8.8, and I knew that I could not avoid this any longer. I think part of the avoidance also was that in order to get a center of excellence, go to a center of excellence, I had to go to the same center where my husband had passed. The same doctors, the same offices, the same pulling up to the valet. And I would mostly walk in there sobbing. I worked through that, and I decided I had to go there because they would get the best result for me, and I needed to know the best result. So I came back with a diagnosis of MDS with ringed cerebroblasts. I'm not sure I'm saying that correctly. It was single lineage, and they said we were going to do the watch and wait program. And that protocol, I've read in the literature by many people who have experienced it, watch and worry.
People who have lower risk myelodysplastic syndromes are going to be living with this diagnosis for years. And some of my patients don't require any therapy.
Well, it felt like, why are we waiting? What can possibly be gained? What benefit is it to wait? Why did you put me through a bone marrow biopsy so I could wait and see what's going to happen? I wanted to be action-oriented. I wanted to get it done. Okay, if I have to have chemo, if I have to have radiation, whatever I have to have, let's do it. And that was not the case with this type of cancer. And it's something that you have to come to accept. And I had a hard time with it initially.
No study in MDS has ever shown that intervening early with a therapy before somebody has symptoms, before they have a compromise in their blood counts, allows somebody to live longer than when we wait for a compromise in quality of life or a compromise in blood counts before we start therapy.
So our diagnoses were very different, but having the same kind of tree that they came from, different sides, was also so bewildering and upsetting, and started wondering, how did we get this? Was it environmental? Like the why of it, which no one really knows. It's not easy. I do a lot of self-talk. I truly do. And every day I focus on what blessings I have versus my other cancer survivors that I see in the office on a weekly basis. Some people have it very much harder than I do. I just try to do the day by day. The thing that is the hardest of this whole disease is the incredible fatigue. And I don't think, because MDS is so not a disease that most people know about, that when I say I'm so tired, I can't go to golf, I'm so tired, I just can't come to this meeting that we're having, I don't think that people really understand it, because I look fairly healthy and I try to do as much as I can, and not a lot. I don't want it to define me, so I do tell people that I have cancer. I'm very open about it, but I don't seem like a typical cancer patient.
Yeah. Over 80% of people with myelodysplastic syndromes have some degree of anemia. So we focus a lot on the symptoms of or signs of anemia. So the sign of anemia, of course, is a dropping hemoglobin or hematocrit. Once that hemoglobin drops below 10, below 9, heading towards 8 or lower than 8, that's when we start to talk about initiating a therapy.
Okay. When I'm very tired, I feel like I am in cement, like a slow-mo movie where you're like, I want to go to the kitchen, to the refrigerator. It's just like you can't even think about taking your key out of your purse to go to your driveway, to go to the car, to go to the grocery store. It's literally impossible. You just have to admit that you can't do it. And that's very hard for someone who doesn't like to say they can't do something. It's very hard for me, very hard, but there are times where you just have to admit it.
All of a sudden, my patient says, I feel like Superman or Wonder Woman for the first time in months. Then we know that anemia, that low hemoglobin, was causing their symptoms of fatigue. Most of my patients are older. So when I'm talking to somebody in his or her 70s or 80s and they say to me, I feel tired, it's hard to discern whether that's I feel tired from my MDS or I feel tired because I really expect myself to feel like I did when I was in my 30s, and I'm not in my 30s anymore.
Because you're older, it's hard to discern sometimes. Is this something that's because of the drug, or is this me, or is the cancer getting worse? Or it's very isolating to stay home and be tired. This is treatable, not curable. And I think it's very important to read and to stay alert as to what's going on in the field, and to go. MDS Foundation, I can't say enough about them. They are a major resource. I had a mutation that is more compatible with the therapies that are available to me and a better shot of survival.
People who have an SF3B1 mutation. It's actually a good prognosis mutation to have. So people who have particularly an isolated SF3B1 mutation, just one mutation in SF3B1, live longer than people who have other types of mutations. And that's why we started this by talking about goals of care with lower risk MDS. The goals of care are to minimize transfusions and improve quality of life. And that's what we can do with these drugs.
And a blood transfusion, because that takes 4 or 5 hours. And I never realized how long that takes, and how it one drop at a time comes out, and it's hours. It's 6-8 hours.
You add all of that time up, you're talking about a full day to get a blood transfusion, right? A full day every 4 weeks. That starts to add up. And that's when my patients start to say to me, this MDS thing is starting to get kind of annoying. Is there any treatment that I can take to start to eliminate the frequency of blood transfusions?
You might as well do it cheerfully, because there is no benefit in crying about it. on a daily basis. There's just, I don't want it to define me, MDS, but yet I want to make sure that if I can help myself or others, that I do it, because I don't think people really understand this.
Always develop a list of questions you want to ask before you walk in the door. I'm a doctor. I go to my doctor and my mind goes blank. It's ridiculous. Like, it should never happen, right?
And I did discuss it with my doctor at the cancer center, and he said, I'm not allowed to say this, but you have to live your life. And if you're feeling pretty good, I mean, I am 78 years old, so I have to live my life. And if there's, for example, last year was a wedding of my partner's granddaughter. There have been Christmases where I'm going, I don't care. I only have this child for one time, and this is my only grandchild. And so I would take the shot. There's always like something to take away your pain, some joy that measures out.